how would you make the perfect doctor? Perhaps you could take the diagnostic genius of Gregory House, one of my favourite TV programmes, and combine it with the bedside manner of EastEnders Dr. Legg. Or do you just leave it to AI? Charlotte Blease is a health data expert and author of Dr. Bot, Why Doctors Can Fail Us and How AI Could Save Lives. And she's with us in the studio. Good morning.
Great to be here.
Great to have you here. I suppose this is the question, isn't it? Because people really do fall into two camps when it comes to AI. Those who think it's brilliant at spotting patterns before humans can see them. And in healthcare, that is an amazing talent. And others who think, no, I just don't trust it.
Yeah, that is a problem. I think in general the debate tends to be very polarised. So we tend to have sort of very dystopian view of it. And even among doctors, I mean, it can lead to a sort of existential crisis. But on the other hand, I think there's too much of a utopian optimism about AI is going to be a cure-all for everything. And one of the things I'm trying to do in this book is to enter that sort of grey space, which is messy, but there needs to be a nuanced discussion, because AI will be good for a lot of things, but no innovation comes without inviting other challenges and new problems. And it's exactly the same with technology.
So when it comes to our healthcare, how do you think you or I might be most likely to come into contact with AI?
So people are already using tools like ChatGPT, for example. Their new range of AI called generative AI, and these sorts of chatbots, some of your listeners may not have used it, but it's a bit like talking to the internet on steroids. You can have a conversation with the AI. And what's been really interesting and very timely with my book is this new version of AI. We know doctors are using these tools, so I've done surveys in the UK 2 years in a row with my team. 2024, we asked them, are you using tools like generative AI, ChatGPT, and so on for any clinical task? 20% said yes. Redid the survey at the beginning of this year, 25% said they were. And although we don't yet have many patient surveys, one suspects that patients are availing of these tools too. So where they used to go to Dr. Google, so to speak, they're probably using tools like generative AI, such as the main one is ChatGPT.
And can people rely on a diagnosis from something like ChatGPT? Is that something we should feel comfortable about?
Well, so this is where it's interesting, because many of the studies that have been conducted to date don't use, about 5% in a recent review, 5% use real world patient data. But I suppose the way I would answer that question too, so I say that the jury is still out, but we do have some very tantalising studies. It'd be very churlish to ignore how impressive these tools are. But on the other hand, I think the key question is to say, compared to what? So there's an assumption always that the human is superior, and in fact, between 5 to 20%, some say it's a bit higher, of patient visits lead to a diagnostic error. So what I'm trying to do is have a conversation in that middle ground about how good are our human doctors, what are the human limitations, because our doctors aren't God. We tend to think that they are, but they're not.
That's very fair. Just finally, when we talk about AI, often people think in their heads, they think about like a little robot with a little face. Could you ever see a world in which we end up going to visit a GP and a little robot person GP wheels itself out?
Short answer, no. But I would say that it's software. So we're using them through our devices. But there may be a day when people look back on this era and with a certain queasiness and think it was rather quaint that we did go to our doctors. I wouldn't put a time figure on when that would be where we entirely see AI, but I do think there is going to be this flux period of both.
Yeah, it's such an interesting conversation. I love that question, because people react so funnily to it. When you ask them about a little robot with a face, people literally lean back. So I often know that people are not massive fans of it. Charlotte, thank you so much for joining us. That's Charlotte Blease, a health data expert and author of Dr. Bot, Why Doctors Can Fail Us and How AI Could Save Lives.
We're only a couple of years away from robot interviewers on radio, I think. But better not get into that one.